Thank you so much to the organizers and the chairperson for kindly introducing me. It is truly an honor to be here celebrating 100 years of American Andhra Medical College's contribution to Bharat. ఆంధ్ర వైద్య కళాశాల 100వ ఉత్సవాన్ని జరుపుకుంటున్న సందర్భంగా వైద్యులు, ఉపవైద్యులు, సహకార సిబ్బంది మరియు రాష్ట్ర ప్రజలకు అందరికీ అభినందనలు. So I am Dr. Srinivasa Malladi. I am actually a psychiatrist by profession, and I have also ventured into social welfare and founded the organization called Hindumitra Seva Foundation. And I am going to just briefly talk about what we do. Among various other things, like our activities include spiritual, cultural, social as well as medical. And we have been conducting a lot of medical programs, including medical camps and medical education events, as well as mental health kind of activities too. So our programs are unique in the sense that we look at holistic wellness, and we therefore build physical, spiritual, mental and social well-being among the individuals. This leads us to next initiative that we have taken up, which is directly providing welfare to individuals who are vulnerable and in need, particularly of healthcare. So these are a couple of examples where, for instance, I have conducted social and financial needs assessment by visiting the patient's homes and then putting it forward in the group. For people to support. And one of the ladies, unfortunately, she passed away, a 34-year-old lady with esophageal carcinoma, and she received support through Hindumitra. And her last words to the doctor in the USA who sponsored her child's education, and she said, "I have no fear that I will die, as I am happy that there are people who will take care of my child when I am gone." And so this has been the very basis for formation of Hindumitra Seva Foundation, to support and empower individuals and families in need. And these are a couple of photos of our health education in particularly village school settings. Now I'm going to kind of talk about the topics, the various things which I'm going to cover in the talk today. I'm going to talk about transplanted healthcare model of India, and I'll compare it with what I call as organically evolved model of the West. Entitlement versus empowerment, need for practical social responsibility in medical education, language of prescription versus language of native people, neglect of public health care, disproportionate tertiary and private health care, role of experts in medical leadership, and out-of-pocket expenditure. And finally, I would make a case that primary health care is everyone's responsibility. So as I said, the subject for today's talk is actually developing a healthcare model that represents India. Of course, I'm a psychiatrist, but I've been advised to keep the topic generic for everyone so that we all represent different specialties. So it's not particularly about psychiatry, this is more about primary healthcare and particularly healthcare model that would suit India. I will want to cover aspects of medical education too as part of the discussion. See, my interest lies in nation building, and I'll be very clear here. The way, the angle I will be using is nation building, and I will have a benchmark of global standards. Not that I am actually able to kind of make a complete case for it, and I'll be very happy to invite others as well for their comments. However, I do disprove the disproportion between preventative and curative services currently prevalent in our nation. I'm proud to say that since independence, we as a nation have identified our unique solutions to our unique complex social issues. But have we made innovations in resolving our unique healthcare challenges is my question. Particularly, ours is a country which is still developing, aspiring to be developed, and it's an ancient civilizational nation. See, I'm an insider as much as an outsider. How am I an insider? I'm an insider because I'm actually abroad, I've studied in Andhra Medical College, and I have recently returned back to India to set up a rural healthcare initiative, and also started practicing in private psychiatric setting. But I'm also equally an outsider because I've been working in UK and Singapore for a very long time, almost 2 decades. My time with medical education has been an open book with so many unaddressed practical questions that remain unresolved. The focus of our education system being heavily biased towards academic cramming hasn't helped the process either for me. But thankfully, ours is unique, our medical education is unique in that we have a clinical setting and it's a nice escape for us from the academic rigor. But however, I do feel that maybe the crop of the new scientific settings in private medical colleges perhaps don't have the same rigor of the patient numbers in terms of clinical experience. These are my views and some of them may be critical. Please allow me to make an argument here if I may. What is also conspicuous is the absence of emphasis on medical ethics, primary and preventative health care. I'm talking about medical education, communication and leadership skills, objective and transparent examination system, fearless learning atmosphere, and an atmosphere of primary research. I think we are possibly doing fine in secondary research, but primary research is where we must be putting a lot of effort and money in. आचार्य शिष्ययोः पक्ष प्रतिपक्ष परिग्रह यः कथाभ्यास हेतुः स्यादसौ वाद उदात्ततः. Ours is a civilization, the hallmark of which was a scientific and systematic approach of inquiry of life with the principle Jnanam Vijnana Sahitam. Now you actually encounter this in Bhagavad Gita as well. It basically means that all knowledge is valid only upon practical application of it and the experience of the results. It would be an understatement if I said that the first time I ever really understood the practical application of my medical knowledge in medical emergencies and critical thinking was when I was preparing for the lab exam, reading the Oxford handbook, the tiny handbook, and I understood the true value of practical application of knowledge during this time. In this exam, doctors are expected to display optimal standard of medical knowledge that is practically relevant, which is commonly encountered clinically, and also critical thinking ability, confidence in practical clinical skills, and effective communication skills. I am actually indeed indebted to all the places that I have studied in India and abroad and worked in, where I learned the value of communication skills, medical ethics, learning to accept that we are always on the journey of being a student and being assertive to say no when I don't know. For me, there has not been a catharsis over the years for the unresolved questions, and my talk can actually easily extend for 20 hours of laments instead of just 20 minutes. Though not a rich nation, our government subsidized our education that we paid only rupees 500 per year with no service bond, and that's a real kind of privilege. Most of us who have gone abroad surely have a huge debt to pay to our Matrabhumi for having nurtured us into successful doctors. Our society had got used to being provided for by the country and successive governments that we feel entitled in education, jobs, farming, and unfortunately election freebies. And this unfortunately numbs our conscience so much that we forget that nation is actually built by people. So, what is a successful nation and its people like? They have a sense of gratitude. Empowered people actually build the nation and its institutes, and happiness for them lies in nation's progress. Whereas an unsuccessful nation and its people have a sense of entitlement. Entitled citizens expect nation to care for them, and there is no end for it. Nation and its institute do not develop as a result, and they have fleeting happiness. They are never satisfied. Something else has to be done to keep them happy. Now I am going to switch gears into comparing the healthcare models. Modern healthcare model of the West is an organically evolved model with roots firmly in European civilization. For the rest of the world, which has been colonized, including India, it is a transplanted model with no roots to its cultural, philosophical, spiritual or medical history. And our philosophy for centuries has been one of holistic healthcare, allowing natural remedies and for us to live as part of nature. And this I picked up from our souvenir. While I don't expect them to be incorporated into mainstream practice, it I feel is unacceptable to not at least be mentioned in a historical context. I mean, I didn't see it being mentioned in historical context in the curriculum when I was studying MBBS. It's as if I have landed in this nation out of nowhere studying in the new medical model, that our country did not have anything before that. Sorry. Oh, I don't know how this is going. So, the Western model, which as I said is organic, surprisingly has cultural and spiritual roots. You may be surprised. Whereas for us, cultural and spiritual roots have been uprooted. It's an alien model. Modern advancements are a continuum of the history of the society of that nation. Ancient Greek concepts are mentioned as a history of development of medical science. In psychiatry, Freud and Jung form the basis for psychological models and that are suited for the Western thought process. Whereas in India, history of the society is shunned, ignored as either being irrelevant or pseudoscience, even without having been researched upon and not discussed, as I said. Native healthcare systems are not even mentioned in a historical context, and such is the degree of uncalled for collective civilizational self-hatred. Superior and rich Vedanta doesn't form the basis of psychology models for this land and society. Organically evolved model moves ahead with innovation, and it places emphasis on primary research. Books and publications reflect the society that it represents and the local healthcare needs and the delivery. Whereas unfortunately in a transplanted model, it is ever stuck there because it's not growing organically and there is no primary research. And recommended books are therefore unfortunately still a lot from foreign authors. I'll skip these slides in the interest of time. And language of medical education, language of publication, language of prescription are the same as language of the patients. In England, patients speak English, doctors speak in English. Whereas language of medical education, language of publication, language of prescription are not the same as the language of the poor, rural, Telugu speaking person. He speaks in Telugu, our prescriptions are in English. And that's not right. There's something wrong there. Through research and innovation, India is making scientific advances to meet its social objectives. Take it ISRO, take it the Covaxin and Covishields, we have done wonders. We as healthcare providers are capable of playing a significant role in nation building that is true to its inherent characteristics. We need to have the right medical leadership and direction to connect the dots from our past through our present and to the future. As professionals, once we are at the stage of being an expert in our field, we are not just experts on our subject matter alone. Our wisdom should be harnessed with our observations, new ideas, courage to challenge prejudice and stigma, educate masses to develop scientific temper in them, and be the champions of what we represent as a nation. I will now touch upon science versus superstition. There is a huge vacuum that is left out there in the society because of poor public health education. And we are leaving our citizens vulnerable to superstitious religious predatory practices, including opportunistic religious conversions in the name of healing and fear-mongering. Majority of them actually just have simple ailments which resolve immediately, or even if it can be treated quite easily. So it's an example of clear urgent need for a medical primary care model to bring in scientific knowledge for social welfare. And we are scientists at our heart. And I'm going to make a case here that we need to bring in the scientific temper into the society through public health education. Our healthcare model was designed to be primary and secondary care, and hence we have primary and rural health sectors. And I'm sure we all have had postings, particularly right in Simhachalam and Sattwara. We also have a department of community medicine. And I had the fortune of meeting my classmate yesterday for a very lengthy discussion, PJ, and we discussed a range of things, and it's wonderful to see the changes that are happening. But I'm still going to make a case that we need to prioritize public health care and community medicine. See, haphazard growth of healthcare model where patient with insufficient health literacy can still now directly access even the tertiary care, and they may end up paying a lot for their very simple ailments. A mature healthcare system is one where the model evolves according to the needs of the common man and national aspirations, so that an economically lean healthcare delivery model, along with affordable, accessible, fair, ethical healthcare is received by the users. You would be surprised, but it may not be surprised, majority of doctors are in private care, which basically therefore means government care is not adequately present, taking care of the majority of the population in the society. And therefore, current healthcare model is lopsided and is weighed heavily towards secondary and tertiary care. In modern times, it is great to see the advances in healthcare. Even the deadliest illnesses such as cancers can be treated successfully, and we are living longer than ever before. However, is the cost to patient and family proportionate to their income, assets and savings? What is their out-of-pocket expenditure? India spends 1% of its GDP on healthcare, and why are private hospitals in India so expensive? And why is public healthcare system neglected? These are questions not just by me, they are being asked by public. Healthcare expenditure among BRICS and other newly industrialized nations, India spends the least per capita. As a result, public spending on a particular patient is only 30%. A patient or the family has to spend 70% from their pocket. Private healthcare in India costs 4 times more than public sector, yet majority of the cases are being treated by private sector. And the expenditure incurred for the patient is a lot, therefore. Economic survey strongly recommends increase in public health spending from 1% to 2.5% to 3% of GDP. If that is the case, if that happens, the out-of-pocket expenditure reduces dramatically from 65% to 35%. Out-of-pocket expenditure, where is it being spent most? 40 to 50% of it is being spent on, 40 to 50% is being spent on medications alone. Right? A lot of families face debts after their loved ones pass away. Nowadays, it's rare for a person to choose natural death at home. Almost everyone dies in hospital nowadays. Soaring hospital bills leading to quicksand and debts and makes us wonder, did we gain anything and who gained the most out of this? As I said, there is a heavy reliance on pharmacological interventions. 50% of the out-of-pocket expenditure goes to medications. What India needs is a well-developed government-led healthcare model with less reliance on mushrooming of private sector. Alternatively, it should be a joint public-private partnership. See, market-driven healthcare model is very expensive for a common man, and perhaps often too aggressive in investigations and treatment, with less emphasis on wait and watch or primary preventative measures. We need to develop the first tier of primary care physicians, and there is scope for such doctors to have a good practice. Government facilities need to be uplifted, and we need to train them in generic skills. As I said, my interest is nation building and equity in healthcare access for a common man. Tertiary care services need to be what they are supposed to be. They should be limited to the top of the pyramid and not seep through the entire pyramid, even occupying the base that belongs to the primary care. Our land and civilizational ethos has been to look at health holistically. Now I'm going to again touch upon a different area now. Successful kind of healthcare programs like vaccination, polio eradication, family planning, smoking cessation. We need to actually come together in terms of collective responsibility. And for instance, road traffic accidents, we very well know how unsafe our roads are. And we need to work specialists like orthopedics, neurosurgeons particularly, should be looking at working with traffic department and NGOs to educate about the risks, because that is primary care there. Psychiatrists like me need to combat mental health stigma. And we need to have a physically fit India. Most of us unfortunately have sedentary lives and we don't have facilities in urban spaces for healthy kind of living. I think it's a primary care matter. Anywhere in the world we should celebrate success when our healthcare system empowers patients and their families. I'm coming to the end. We need to empower people such a way that they are financially comfortable and we don't end up leaving them bankrupt. An option which allows them to live well and live long and not just survive long. Finally, I would like to dedicate, unfortunately I am not able to show the slides, I would dedicate this presentation to Dr. Seva Garu, who is a Prema Swarupini, and to Sri Bhagatla Parameswara Garu, who has been my mentor and driving force in looking towards primary health care as a need of the hour. Thank you so much. Thank you so much.
That's a great presentation, Dr. Srinivasa. You brought out very relevant points. Every time patient comes back with the prescription how to take the medicine, because she definitely they can't read the English which we have written. And also mental health in India did not start, psychiatry did not start with Sigmund Freud. In Patanjali Yoga Sutras, the description of mind is given in a far better way than any Western books. So this I keep teaching my postgraduates all the time. And the primary care physician is how much important in Sumati Shatakam, that one padya, it says Appichivadu Vaidyudu, Edakagaka Palu Yeru, Vijudu, Choppadinattu Yuru, Hundumu, Choppadinattu Yura, Charakumu Sumati. So a doctor is a must for any village in ancient India. And even in Mahabharata, in the Sandhya and Vidura and Dhritarashtra conversation, the mention of mental health is made. If someone is suffering from mental illness, they are supposed to take treatment. So that stigma and all, it was not there. Unfortunately, now it is our education itself is imposed. What he said, Acharya Sishya Paksha Pratipaksha, that questioning attitude, it is lacking. Right from LKG onwards, it is imposed education. Continuously, it is imposed spoon feeding. So it has to change from the grassroots.
Thank you, Chairpersons. It's been a really wonderful session. And to do the honors, I request the Chairperson to present a memento to the speaker, Dr.
We want to thank the organizers for giving us this opportunity. And mental health topic and the first topic, special thanks.
Well, it's been really nice hearing to Dr. Shastri talk about the transplant model. And he talked about the mature model which India needs to evolve and develop. So we take back very good messages as far as the rural healthcare is concerned. Thank you very much. We move on to the next topic. And see, the magnitude of cardiovascular diseases in any country is quite high. But what the World Health Federation roadmap for digital adoption